course, it's my pleasure. Thank you so much, and I really appreciate you driving all the way up here to be part of this adventure that I'm
The
taking.
movement.
Yeah, the
Oh
movement.
yeah.
I tried, like I explained to you before. I tried doing this with some other guys, and I had been doing it for a couple of years, and it kind of
Mm,
fell through. So
mm,
I decided, like, look, I this is my passion.
yeah.
I've tried doing this many different times in my life with different modalities, and
Mm,
I felt like this was a great one for me in this time in my life to explore educating people through my voice, and
mm-hmm.
then also, being able to invite people like yourself that are in the healing realm, so that we can basically tell people that there's a lot of people like us that are out there that care and want to make a
Yeah.
difference, and so that's why we're here together today. So thank you again.
Yeah.
I really appreciate it.
Yeah.
So I guess we can start, and then I guess my first question would be that for you to introduce yourself. I guess you can introduce yourself kind of to me, and then
Okay.
just like a little bit of like your background, and then
Sure.
kind of like why you got into everything,
Yeah.
and we can just start from there.
Okay. Well, my name is Dr. Tasha Mintzer.
Mm-hmm.
I'm a doctor of Chinese medicine and a licensed acupuncturist here in California and nationally.
Mm-hmm.
And what else could I say? I'm a medicine woman as well. I'm fourth generation. It started with my great Lola Marta.
Mm-hmm.
She's from the Philippines, but she's passed on because she was my great, of course. Started with her, and then on to my other Lola Kaling, and then my Tita Alice. So Lola means grandma, Tita means aunt,
Mm-hmm.
Tita Alice, and then now it's me. And these women, I come from like generations of women that were herbalists, they were medicine women, they were midwives, they took care of women in their villages. My Tita Alice, she was a monk. She lived up in the Korean mountains in South Korea, and she studied with monks there, and then she brought medicine to her people. So I feel very connected to them, even though I didn't grow up over there. I grew up in the States. I feel like I'm carrying that medicine in my lineage.
Mm. That's beautiful.
Yeah, and it comes through when I'm helping people. So I feel like I can channel my ancestors through what I do, and my why basically is I was a patient for a really long time, and I still am. And I've used Chinese medicine and herbs since I was a little kid. And one of my biggest inspirations was my Tita Alice. When I lived in the Philippines, I got very sick. I ended up having malaria at the age of 5. And she treated me with plants
Mm-hmm.
and with, it was like she was making these potions. She had like a mortar and pestle, and she would like grind up like roots and barks and leaves, and she would make me drink the stuff that tasted awful, like
Mm-hmm.
tasted like shit, but I did. And I got better, and I went from having like these sores on my legs, like to having a fever for like over a month, like in bed, like so sick, diarrhea, like everything. And she cured me with plant medicine. So I'll never forget that. And also with acupuncture, like she treated me. So yeah, I never forgot about that. And but that like went away like as I grew up, like I didn't really remember my lineage as much. Like I got caught up just in life and living in the United States. It's different culture,
Mm-hmm.
from there, and just getting really far away from my roots. So that was something I had to rediscover as I got older. But yeah, I've had a lot of health issues. Like I've had cervical cancer, I've had multiple knee surgeries, I've had shoulder surgery, I've had migraines, acne, I mean reproductive stuff, like you name it. I feel like I've had it, and I've been able to heal from all of these things like the natural way. So my why is to like share what I've learned, what I've experienced, and to help other people like discover that they can heal themselves if they just like reconnect to nature
Mm-hmm.
and have that understanding and that balance. So yeah, it's pretty cool.
That's an amazing story. You
Thank you.
summed that up like really, really well with
I
a lot.
tried. I was like, hey, there's a lot of points there.
Yeah.
How do I throw that together?
Yeah, so I mean that's incredible. Like, pulling from your ancestors, do you think in a way like they kind of, being in the U.S. and straying away from your roots, do you think they kind of pulled you back in a
I think
sense?
so. There's been a lot of like events in my life that have just kind of led me back to like wanting to learn about my roots. Like I went to Israel. My dad's side is Israeli. They're Hebrew. And so I went to Israel and learned like all about like that side of my family. And I mean them too, like they were mystics. They studied the Kabbalah. Like there's this like mysticism in our family.
Hmm.
And then there's my mom's side, so going to the Philippines, living with the culture there and getting to know them and coming back. But yeah, I fell off and I had to like rediscover them a lot of times. I did a pilgrimage. I walked 500 miles from the mountains in France, the Pyrenees Mountains in France, to the coast of Spain. It's the Camino de Santiago. I don't know if you've ever heard of that
I have.
hike.
Yep.
Yeah, so
Hmm.
I did that. Have you done it?
No.
Oh, you gotta do it. But yeah, that kind of changed my life too, and it was a walking meditation where I was like asking, I was like, I need help. Like I didn't at that time. I was like, where do I go with my life? Like, what am I doing?
Yep.
And I got messages on that walk, like this is what you need to do. Like you're gonna go to acupuncture school,
Mm.
and that's when I got that message. So that was like another time. Yeah, getting back to your roots. There's just so much stuff.
Yeah, no,
Yeah.
that's great. I mean, like I really feel like those kind of like explorations through walking, that
Mhm.
like that flow state of like
Mhm.
really like diving into it over a long period of time is also like a form of meditation, and also like you can find a lot of guidance in that too, because I've done the same thing. I've gone on massive treks
Yeah.
before, and it's kind of shown me through the repetition and like the breathing and everything, and going on those everyday hiking 15, 20 miles, just like wake up, crack
Yeah.
of dawn, and you
And
just
you gotta
walk. You
go.
walk and you're able to have so much like silence within yourself, so you're able to tap in to those other
Yeah.
parts of you that your ancestors are there. They're in that part of you that you're able to recognize, and they're able to show you, kind of help you guide where you need to go in life. I think that's important that people do those explorations, whether they're capable with physically with their body, or put themselves in a place where they're able to find that peace and silence for a good amount of time,
Yeah.
so they can like jump into those types of things.
Right? Because it takes you out of the everyday, out of the
Mm-hmm.
noise, so you can
Yes, and there's a
actually
lot of
tap
it.
in.
Yeah,
Yeah,
I mean,
constant.
just for us, like moving up here too, being in the heart of Pacific Beach, because we
Yeah.
were like right on the beach. And for me, like I'm extremely sensitive, and so is my partner. And for us, just the dial, like tuning the frequency, just like shifting it ever so slightly with being more connected to nature. Up here,
Yeah.
where like you saw, we're able to just like go be in nature
Mm-hmm. So
if you want to,
awesome.
and just like you can feel so much of a change and shift if you're that sensitive. I think that everybody's that sensitive, whether you're like more acute to it or not. But those little shifts sometimes can make a huge difference overall in
Yeah.
your body, and everything, especially with all the frequencies
Oh
these
yeah,
days of
there's so
everything.
much. I
Yeah.
did this biofeedback test on my body recently and it showed up that I had like all this radiation
Mm.
exposure. And I
Wow.
was like, well, it makes sense cuz it's like we live in the city, like we're around all this EMF like all the time, like you can never get away from it.
Yeah.
We're on our phones every day. So yeah, it's like we're infiltrated, and that blocks signals. It blocks signals like through your body and the
Hmm.
meridian system, that I treat every day. So yeah, I could see how being up here would be
It was
literally
a big
a breath of
shift.
fresh
It
air.
was, it was a shift, and
Yeah.
I've tried to get away many different times throughout my life, because I love travel. It's like one of my
Me
passions. Just
too.
I've learned more through my travels than any amount of schooling I've
Mm-hmm.
ever been on. But also, when I do my travels, I also tend to find that like I put myself in more rigorous situations than most people, or like I'll go find like that place that I need to go to do like a vipassana, or you know what I mean, like
Yeah.
go, you know what I mean,
You're
like
searching.
I'm searching to go find that, and then once I find that place, I'm like, oh, here's where I'm supposed to be to learn what I needed to learn, like in this place. You know what I mean? So I'm always attuned to know when it's right for me to just like cut things off and be like, I need to go do like my thing or whatever. And
Yeah.
even my wife knows that too about me. Like I'm like, for myself and my own spirit, like sometimes I just need to go away from like everything and like recenter myself and come back to the craziness
I'm
of
the same
you know,
way.
because it's like I think if you're not able to do that for yourself, then you can literally literally push yourself away of where you need to be on the path of where you're going to help people, and then also live, with the sensitivity of everything else that's happening around us.
Yeah, and being true to yourself. And I feel like when people don't tap into that joy of their essence,
Mm-hmm.
that's where mental health, gets
Yeah.
affected,
Mm-hmm.
right? We see a lot of that, and then other diseases start manifesting in the body, in the physical. So,
Yeah. Yeah, like one of the things that I feel is like my spirit medicine in a way is like know thyself, because like when you're able to know yourself and know what you need for yourself on that spiritual level, at least to go off and do what's good for you, it's necessary, because when you come back, I'm a better person for myself, for my family, everybody around me, because I've been able to just like take that deep breath and like, like I got to, like I gave some love to myself for what I needed to do, whether it was like, hiking or going and finding that spring or what have you. It's like so important to do that. And some people look at that sadly as like, oh, it's more like ego driven, or it's like you need to go be selfish, or it's like, and it's stuff like that. And it's like I think we live in a society where it's like, no, like you need to do that every once in a while, because we're here ultimately for ourselves in a lot of different regards, and it's important to find that within yourself in this lifetime so that you can become a better person and be happier, obviously, because that radiates to everybody.
Totally. And being alone, I think, is a good thing too. Like a lot of people are afraid of being alone.
Yes, I love it.
Yeah, I do too, and it's important.
Yeah.
You need that.
Yeah.
Like you said, know thyself. Right. That just sums it up.
So I have a question for you. I was thinking earlier. I was like, what should I ask? And sometimes I always like to ask, a lot of like what you find is like the root cause of certain things. I mean, ultimately, when you boil stuff down, especially within this society and where we live, there's going to be um, pretty much a handful of things that you see time after time that come about. So like, what would you say to people that live in, between like San Diego and LA, or even like bigger cities, that you can recommend to people that you can see more often than none that you treat? Does that question make sense?
Yeah,
Okay,
totally.
perfect.
And it's not just one thing. It's like a collective of things, right? So diet. I mean, food is the first medicine. And I was just telling a patient this morning. I was like, it's like 80% of your health is what you're going to put in your body. What are you nourishing your body with, right? What are you allowing in that is going to convert into something so that you can thrive? So food is just so essential. And I know, like, over the years, like, the food systems have kind of gone downhill, right? With, like, soil degradation and, like, what is it, glyphosate being sprayed on everything, right? Just all that crap. But, I mean, we still have so much food in this country that we have access to. And I hate when people are like, well, I can't afford organic. And that's a lie. Yes, you can. Because there's plenty of, like, places that are selling organic at discounts now. Like Walmart sells organic food. I mean, I don't go to Walmart. That's not my favorite place to shop. But if you need to go there to save money, then go there, and you're voting with your dollar too every time you buy something.
Absolutely.
But yeah, food is like so essential, like really being conscious of your sugar intakes. What are you eating? Are you eating fresh food? Are you eating frozen food all the time? Are you eating out? Like, what are you putting in your body? So food is probably like number one. And we live in Southern California, so we have so much food here, like so much produce. So I just don't like the excuses. I was like, no,
Yeah.
it's around. You can find it. I do a farm box weekly that gets delivered to my house. It's $50, and we get fresh, organic fruits and vegetables in the box, and it lasts us a week. $50.
Yeah.
So there's
no excuses. Yeah. I mean,
yeah.
Another thing that I'd like to point out too is like, I talk to a lot of people and there's just an overconsumption also. So I think a lot of times people are like, oh, well, like I don't have enough based on what they consume. And I think people consume way too much
They do.
also.
Of
So it's
crap
like
food.
Of crap, but they need to basically reduce their diet so that they're understanding the value of what one organic apple does for you versus like a big pile of food is essentially that apple.
Yeah.
You know what I mean? So like sometimes people have to understand like the equation of what everything comes down to like, on a nutrient level.
Totally. Yeah. So, if you're eating nutrient dense foods, you're not going to have to take as many supplements. Like everyone's all about supplements and protein shakes. And that's not food.
Yeah, it's not.
Like it's made in a laboratory, and I do recommend supplements to my patients, but they're meant to give you a boost and they're meant to not be taken long term.
Yes.
Like you shouldn't have to take a multivitamin every day. You shouldn't if you're eating good food.
Yes, I agree.
Yeah.
I do take a multivitamin, but I do agree. I think that I supplement my diet because I'm also working on my diet. Like I also feel like I can change a lot of different things, and I'm constantly working towards that. Yeah. That's also one of the reasons like I decided to move up here and get the land that I needed to grow the vegetables, to have direct access to it and things like that. But but I agree. I mean, like ultimately, you should be eating everything that you need for all your vitamins and minerals. So it should be all there for you. But of course, these days we're not taught that.
We're not.
So like that's a big thing too. Is like most people, by the time they get to the point where they're more health conscious, they don't have the education backing through school or what have you that have taught them from an early age to say like, oh, this is how you should eat, unless you have parents that actually showed you and the curriculum how to do it. It's just not
most
there.
Most
people have no idea. You know what I mean? So like when you hear supplement or like something like that, they're like, oh, if I eat crappy, I can take this stuff to supplement all the good things I should be eating. You know what I mean?
And that's not the way it works.
No, it's not. But sadly, that's the narrative.
Mentality.
That's the narrative that you see. And so obviously diet, and what would be another one that you could say?
Yeah, so being outside, I mean, it's so underrated. And again, we live in Southern California, so we have the weather here. So when people are just not getting outside, it's like, again, what is your excuse?
Yes.
And accountability. Like I really think, just in general, this is for people across the world, is like just having accountability over your own health, like not expecting that when you go to the doctor that they're gonna fix you. And I tell my patients that all the time, like I'm just kind of tweaking some things, but it's your body that's healing itself. Like I'm not healing you. I am not your healer. I don't call myself a healer. I think that's kind of a weird word to use.
Yeah,
it's a little controversial for me because I'm like, I don't really want to claim that. Like it's a little egoic to like say like I am your healer. Like no, it's your body healing itself.
Yeah.
So yeah, having accountability over your health, getting outside, eating good food. I mean, these are simple things, right?
Yeah, they should be.
That aren't really so simple for people to do.
And so I wanted to touch on that one point you made, and I think it's a beautiful notion because it's like something. Accountability is one of my favorite words. It's something I live through that word. But at the same time, I've also been like a life coach and a hypnotherapist and all these other things in my life. And whenever I would sit down with people, the exact same thing. I would be like, I'm here to guide you to what you need to figure out in your life. Like I'm just a channel. As almost like a reflection of yourself sitting in front of you, so that at a certain point I want you to think of you and in front of you, and you're literally just having a conversation with yourself,
with
and
yourself.
we're just gonna work out this stuff together, and I'll make recommendations for you here and there. But ultimately, like I tend to find with a lot of people, it's more so psychosomatic, and so when they start to be able to look at themselves in the mirror and have those conversations, a lot of times we can work that stuff out
Yeah.
internally with ourselves, but sometimes it's necessary for a healer or, somebody to guide them to where they need to be through all the different modalities. So I think
Yeah.
that's wonderful that you say that, because I think a lot of different people like to say like, oh, I'm in control of the situation. Here's like what I'm going to do, and you're going to abide by my guidelines on fulfilling what it is that I think you should do,
Yeah.
kind of thing. And though I see that that works in many different ways, I think that also in that path, people can also not find everything that they're looking for. They can lose stuff along the way, because ultimately we're all so unique, and we're a universe within ourselves, that all
Yeah.
the little intricacies of the universe need to be put in that overall picture. And sometimes when you're not guiding somebody through the healing that they need to receive, and it's through somebody else's perspective, they can lose parts of themselves throughout that process.
Yeah.
So I think that's beautiful that you say that, because in all honesty, I don't meet a lot of people that uniquely say what you just said and that I agree with, you know.
Wow.
Yeah, and I mean, I listen and I watch so many different things, and a lot of times, like, it's very regimented. Like, here's the steps we're gonna take, and I've learned.
Here's
this.
the manual.
Yeah, I've learned this, and
Yeah.
buy my book, and if you follow these steps, like, this is the result you get, kind of thing. And it's like, I agree with a lot of it, and I see the value in it, but at the same time, it's like you also like everything I just said. We're all so unique and so beautiful and so elaborate that we have to understand that there's so many different little parts of ourselves through an accumulation of trillions of experiences.
Yeah.
That, if you want to get to the origin of healing and why it is that you're dealing with certain stuff, it's all the little things as an accumulation, to the overall picture. Because, like, people don't realize, like, sometimes I believe that in one small experience, the wavelength and how that carries throughout your life could be like the origin story of what affected you.
Totally.
Possibly.
Could be.
Yeah.
Yeah.
Right? And it's like, sometimes it's a multitude of those experiences, right? But sometimes it can be just that one little thing. And if somebody's being like, this is what you need to do, and it's not connecting with that kind of stuff, then ultimately they're not going to get to that, like, one little piece of the puzzle. So
Totally. And in terms of origin stories, I wanted to touch on tapping into the inner child too. And I think not enough people understand what that even is, or even willing to go there to investigate. But I think a lot of our traumas that we deal with as adults and the physical manifestations of disease come from, well, what the hell happened to me when I was a kid? And time again, I see it with patients. It goes back to, like you said, an origin story or an event that triggered something to cause them to have an eating disorder, to have migraines, to be angry, like whatever it is, to have cancer. It's like it all came from, there was a cause, like something like snapped in the body and then started to like alter like your genetics and cell makeup and started to make things, like happen. So I think doing more work around that, people should try to do. And I also work with Combo, which is a shamanic medicine, which allows people to tap into their spirit, to go back in time, to, research their inner child, and to, ask, what happened? Because a lot of times we block out what happened in the past, too.
Absolutely.
I don't know if you've experienced
that.
Yeah,
I've had a pretty traumatic childhood, so
yeah.
I'm still working, through
So
all of
am I.
it to this day.
Yeah.
So like I'm always like, finding different ways of healing everything that I've experienced, and I know that it's not going to be in this lifetime that I solve it all, and I've already come to like accept that. Like it's like one of those things that it's like I truly believe that it's not just this lifetime that sometimes we're healing. It's a multitude of experiences through, millions of years possibly of everything that we've
Yeah.
accumulated. And so, what like do you ever feel that or see that with certain people where sometimes like people think that it's like was here in the now, but in reality it was actually stems back from a
Yeah.
long time ago?
Yeah, and sometimes I struggle to with like how do I explain this to
Hmm.
this person because they have like this Western medicine mindset, and I'm already doing kind of woo woo medicine. Like people look at acupuncture like it's
Yeah.
like that, even though it is evidence based and there's a scientific side to it. But yeah, I'm like, how do I explain this to this person? How do I bring them into this understanding that it's beyond them?
Hmm.
So that yeah, that is challenging sometimes. So I have to like plant little
Yeah,
seeds,
yeah, yeah.
and then
Create different
yeah,
stories and all
yeah,
kinds. Yeah, I'm sure it's challenging, but sometimes I feel like I always when I would work with people like with hypnotherapy, sometimes it would be like asking the right questions so that you could find that story that works for them, whether it be like the origin story with like Jesus Christ, or like like you would find something where you're able to be like, oh, and remember, like like somehow tie it in so it doesn't have to necessarily be like this like, ooh, and it's ghosts. You know what I mean?
right,
Kind of thing. And then
right.
people are like, you'll see the just the
Yeah,
glaze
they're like,
go over their
no.
eyes, and they're just like, no, I'm not listening to you anymore.
Yeah,
You know what I mean? So you
yeah.
got to find that right path for each person to where you're able to kind of tap into what their belief system is, and then you really start to release stuff just by them being like, oh yeah, and he did go through that kind of thing, and then you see like the
Yeah, the light
sparks
bulb.
the sparks
Yeah.
kind of going off. But yeah, it's very challenging. I mean, just human beings and how we wire ourselves is like it's very challenging to show that look like there is a fundamental basis of healing with this, and there's proof on every dynamic. But for some people, there's still just like won't even come to accept
Yeah.
the aspects of the science base and so many other basis of why acupuncture is proven to be so beneficial in
Right.
the healing process or just naturally in general. Doesn't matter if you need healing, it's just a benefit to your life, right?
Yeah.
So what kind of acupuncture would you do on somebody who's just going in to be like, oh, I'd like to try it, like I would maybe like a simple process for somebody to understand the value of it and getting maybe just like some chi flow or blood flow to
Yeah.
feel the difference of the
Totally.
vitality. Like, what would you do for somebody just coming in for something simple as that?
Simple, yeah, just to get a taste of what does this feel like,
Yeah.
right? So I actually do auricular acupuncture at community events. I did one at the Little Sedona Expo a couple weeks ago, which was
I saw that.
psychic healing arts fair.
Yeah, I saw
It
that
was
on
so
Instagram. I
rad.
saw all the pictures and everything. It's very cool. I
Yeah.
love Sedona.
I know, I do too. I know.
It's beautiful up there.
Totally. But yeah, so I did auricular acupuncture there. And the cool thing about auricular, so that's the ears, the auricle, right? And there's all these points on the ear that connect to the vagus nerve, which is the longest nerve in your body. So you can influence the whole body with just doing ear acupuncture. And so I was doing it there, and that's basically it. Like, you're getting a short treatment, you're coming to sit with me for 15 minutes, and you're getting a taste of, well, what does this feel like? And it was so cool to see people sitting there, like almost falling asleep in their chair, like totally like dropping in. And there was so much going on. Like, it was loud. Like, we're in a convention room. There's like tons of people walking around, all these demonstrations happening. But even just to do that, to do 5 points on each ear, like resets your nervous system. And that's how powerful it is. So yeah, someone that wants to come in just to experience it, I would do that. Just that.
So, what do people typically walk away with when they have that experience?
So they have a sense of peace, a sense of calm. We call it calming the Shen. Shen means spirit in Pinyin. So yeah, they like, and I also call it Acu Stone. Like, someone looks like they're kind of high when they walk away, like they're feeling floaty. because their body has released all these endorphins to allow them to relax, to allow them to have like less pain, to allow the inflammation to subside. And again, it's the body healing itself, just with a little bit of a push from needles.
Yeah. And how many needles are typically put?
Yeah, I mean, you could do a lot, but I just did 5 on each ear. Yeah, that's it.
Have you ever had anybody with an experience like that come back and had adverse reactions?
Adverse? No, not necessarily. I wouldn't say adverse. You can have adverse reactions with acupuncture. And this is why, as a practitioner, we need to be mindful of the person that we're treating. So if someone comes in and you can tell they're very deficient, maybe they're like really frail or they haven't eaten, like someone can pass out after having acupuncture. So there's a series of questions we have to ask. Like when I first see you, like I'm already sizing you up, like just seeing you, like I could already tell things about you just by looking at you or by the tone of your voice. Like we're trained to assess somebody right then and there before I even put my hands on you. Like I'm trained to look for like certain nuances.
Do you ever look for like or see energies of somebody like aura or like the person's like overall vibe outside of their body? Because sometimes people are very like, oh, I'm fine, you know,
kind of. They're not.
Yeah, but they're not. They're not. You know, and you can like sometimes I tend to find with like acupuncturists or even so far as like massage therapists, they can like you when you do it regularly, you start to feel a person when they're coming in. You know, it's just an intuitive thing. Do you think over like the years of doing this, you become more intuitive? Like the second someone walks through the door, you're just like you already start picking up on different things.
Absolutely. Even just by talking to them on the phone, like I can hear things in their voice. And then when we take pulses, so there's 12 pulses on each side of the wrist. There's 6 on each. And that tells me how the energy is flowing through the meridian systems in your body. And you don't even have to tell me anything. You just come lay down on the table and I'll take your pulse. And then I could ask you, hey, did you eat today? Oh, no, I didn't. I can feel it in your pulse.
Yeah.
Like it's telling me something. Oh, have you been sick? Yeah, I had a cold. I could feel it in your pulse. So even just that alone can tell you so much.
Do you feel anything else besides that? Like when you're starting to work with somebody, like right when they lie down, you start, going through the sequence of like figuring stuff out?
Yeah, so I'll palpate meridian systems too. And just like even touching like where a meridian's flowing, like if there's like a bump there, that tells you, oh, there's a blockage there. Just those little things. Or if someone has like an odor, it might smell sweet or they might smell sour or rancid. Like that tells me a lot about your digestion,
Or the stress levels and the hormones and everything else that somebody's dealing with.
Yeah.
Because of course stress I always tend to find like I smell differently when I'm like super stressed out, or other people I know, I'm like, man, they smell so different than they normally do just because of everything, that we're dealing with. But that's very insightful to hear that. And then so what would, like, on the opposite spectrum, that's something simple, like what would be a much more complex, like, like giving of like, going through like a sequence of stuff where somebody's like obviously dealing with a lot, having different issues. Does it like, because you're talking about like 30 minutes, is there like a long treatment that you would give somebody if they're dealing with like a multitude of stuff?
So it depends. If they're having a chronic illness, like I have a patient, he has MS, he's had it for like 25 years. And he has needed a lot of treatments. I've probably seen him like 45 times. And it's not until now are we able to start like tapering off of his treatments. So it depends like what we're dealing with. If it's a chronic condition, if they've had it for a really long time, they'll probably need more treatments consecutively at the beginning, and then they can taper off as they get better, as their body gets back into balance. So yeah, you definitely need more when there's a lot of layers. Like if we're dealing with multiple pathologies, multiple diseases, you're going to need a lot more sessions for sure. It's going to take time because it took time to get there. It's going to take time to unpack it, right?
And then like when someone like with something like MS, like what is your overall like goal in trying to figure out like that specifically?
Yeah, so the goal is, well, this patient in particular, because it presents differently for certain people, but helping his memory because he can't remember anything
Wow.
anymore. So we've seen a shift in his memory. Like now he remembers, because I play music, I do house calls for him and I'll play music when I come. He remembers the songs that I play. He
Mm.
doesn't always remember my name, but
Mm-hmm.
he's starting to remember the songs. So
Mm.
we're seeing, okay, it has an influence.
That's awesome.
Sleep is a big one. Like our bodies do the most healing when we're sleeping.
Yep.
So if you're not sleeping, and that's another one for the people from LA to San Diego, get sleep.
Yes.
Right?
Well,
I
just
mean,
in the U.S. in
yeah.
general, I mean, like we with all the multiple jobs that husbands and wives and all different walks of people are having to do, like it seems like
Yeah.
not necessarily the amount of sleep,
It's the
quality
yeah.
of sleep. With our phones and all this technology and everything, and
Yeah.
looking at stuff right before we go to sleep, and
Yes.
like staying on that high frequency wavelength, and then trying to take it down a couple notches is very hard to do, especially with everything that we're fed every single day.
Yeah.
You know what I mean? So
There's too much stuff flashing.
yes, everywhere,
Yeah.
all the stuff going on. But do you like? Is there a treatment for people that are wanting to just like simply do something to like lessen their anxiety?
Oh yeah.
Because I think that's like a root cause for so many people.
Mm-hmm.
Just it's running rampant right now with everything that's happening in the world, and like I see it
Yeah.
so much even with just normal people walking down the street. Like I'm very sensitive to just aura and people of where they're at, and I can just feel the anxiety of people. And it sucks because I'm just like, man, I almost want to go up to every single person and be like, boop, and like, just like it's okay, like
I
you
know.
need a hug, like just like bring it down a couple notches. So like, is there a treatment and like maybe even a price point that you would recommend for people? Just like, here's what I would do for you for like this much, and to help you out with anxiety.
Yeah, I mean, again, like, because we're the same, but we're different,
Yeah,
right?
absolutely. Yeah, I agree.
It's like not everyone gets the same like amount of treatments and stuff, but I always tell people to get a good like 4 sessions in, so like once a week for 4 weeks to really give your body like kind of a jolt, like a reset,
Mm-hmm.
and then after that we could start to either taper you off or maybe you'll need another 4 sessions
Yeah.
consecutively. So I think I feel like in my treatments, I don't know for other acupuncturists, but I think within 4 sessions you can start to influence a change.
Mm-hmm.
You can start to see like things are happening. Like the digestion's improving, sleep is improving. Like I was gonna say about that patient with MS, his sleep changed drastically through getting a lot of acupuncture. So now his body is able to like heal better
Mm-hmm.
because before he was like waking up 5, 6 times a night, was going
Oh,
to the bathroom like multiple times in the night.
yep.
Now he wakes up 1 time a night and he sleeps through the night, and his wife is getting sleep too
Yeah.
because she's gonna have to help him, right? So it's
Yes.
like helping
That's
her
huge.
too.
Yes, you're helping multiple parties. That's great.
Yeah.
Yeah.
But yeah, I mean, for anxiety, it's not just one set protocol, but yeah, like getting 4 treatments in and then seeing from there what the patient needs
Mm-hmm.
is a good like reevaluation spot, I would say.
Yeah.
Yeah.
Because I mean, like everybody has kind of like a different level of a shell
Yeah.
too. So
Yeah, and they don't
sometimes
always,
you're like sometimes like one session could do it. Like it's gonna be 20 sections before we start cracking that shell, before we start getting in there and getting what you need. Because I think it's also like an allowance thing too. So many people just like are so like conflicted with the allowance of help. Where like they can be fighting that also, and I've seen that with working with people also.
Yes.
It's until they start allowing the healing in and the love to start the surrendering to it, where it starts coming. Where like sometimes the second that little crack happens, and it starts like instantaneous like love and healing. But until they allow it, it's hard. Even with acupuncture and everything else, because a lot of it is surface level to a degree. You know what I mean? So, yeah, I've really seen that a lot of times with people where they come to the acceptance where they understand that you're there to help.
Yeah.
So,
I'm not a threat.
Yeah, you're not there. You're there to help them, and I think that more people need to know that there's people like yourself that are there and willing to give of yourself all the time to make that difference for people, because ultimately we want to be surrounded by people that are happy and passionate about life, right?
Yes.
So we're there to do that, to help these people, but for people listening, you also have to allow that love and healing, and sometimes just even the thought of that is that first step forward, and more often than none, when they come to you, it's that first step already. So know that walking through the door ultimately is like where the first stepping stone takes place for people to allow that healing to come in. So
yeah, and I wanted to say also, like, choosing your practitioner wisely, like picking someone that you vibe with. Don't just go to some place because like your insurance will cover it. Like, be more picky.
Yep.
Like, you want to go to someone that's going to hold space for you, so that you can crack open that shell and have that experience and have that release, because that's where the healing's going to happen.
That's wonderful.
Yeah.
And so how do you hold space for people?
Yeah, so I mean, our treatment room is designed so that it's like really relaxing. It's almost like you're going to the spa. Like, there's nice relaxing music on, of course. There's plants in there. I love plants. The lighting is dim. I hate what are those
fluorescent lights? Yeah.
I hate those. We have them in there. I don't even turn them on.
Out of you.
Yeah, I don't even turn them on. So the lighting is dim. Like, there's a salt lamp in the room. So that's like the aesthetic vibe. But when I get someone on the table, like, we breathe together. Like, I put lavender in my hand, I have them smell it, because lavender is like so sedating in a way. Yeah, and it already like makes you drop in.
It's powerful medicine.
Yeah,
for sure.
It is, and it's just like one thing, right?
Yeah.
But yeah, we breathe together, and then that helps me get in tune with that person's like body. So like, once we like start breathing together, it's like setting the stage almost for the treatment, for that person to drop in, and then I drop in with them, and that we're on the same level. And then I start to put needles in.
That was great. I got relaxed. I got relaxed just from hearing that. Yeah, that's wonderful. Just the breathing part and everything, and becoming in tune. It's like, oh, it's so great to hear, and I'm sure people can feel that as well.
I think they do.
Did it take you a while to kind of learn that process of how it's like you just knew?
I just knew.
Yeah.
But also, I meditate regularly, twice a day. So that's like my way of dropping in. So I was like, I'm going to do this with my patients.
Yeah.
Yeah.
That's so cool.
I'm going to force you to drop it.
Yeah, it's so I'll tell you my acupuncture story, and I only have one, and it's not a good one.
Oh no!
Yeah, I'm sorry. I had a cousin that was into Chinese medicine as well, and she actually went through all the schooling for it. But at the time, she was studying in Oregon, and she invited me to come out to the facility where there was people in training.
Okay.
And so she's like, "Oh, I know this person. She's in training. She's wonderful." Da 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 da. And then I went in there. I was like, "Sure, it's free. They need people to work on and practice on." So I'm like, "Yeah, I'll be a guinea pig for the day."
Yeah.
Right. And just to learn and get a feel for just another healing modality. And so I went there, and they're like, "Oh, what would you like to work on?" I'm like, "I don't really know. Like, what is it that I need to work on?" And they're like, "Oh," and they did the pulse and everything else. They're like, "Oh, I can see like you have a little less chi flow in like your left side or something along those lines." And I remember like they did just like maybe a couple in different places, but they did one in particular like on my foot, like in the center of like my left foot.
In the bottom?
Yeah, like maybe on the bottom somewhere. And so for whatever reason, like when she took that out, my foot was hurting. And I was like, oh, like it's weird because it felt like a bigger needle like went in there, like other than like rather than this tiny little thing. And everything else was fine. I didn't I couldn't really feel anything else. But for whatever reason, that day my foot started hurting more and more. And then by the next day, it literally felt like someone took a hammer and like hit my foot like as
Whoa.
hard as they could. And I could not walk on my foot for like 3 days.
3 days.
Yeah, it was really bad. Like it was excruciating. And when I looked at my foot, it didn't look like it was a giant swollen foot or anything like that, but it hurt like really bad. And I didn't know what it was, but it was also very interesting to me too, because I was like, man, this tiny little needle went into my foot, but it literally felt like someone hit my foot with a hammer. And so I was like, it really, I've never had acupuncture since then. But it was very.
You haven't?
No, but it was very.
Oh, no.
And not in the sense that like I'm not going because of that reason per se. It's just that was very influential for me to also understand that this tiny little needle can also make that big of a difference for whatever reason. And like I also like to point out that when I say that there was pain involved, I also like to mention that I don't always interpret it as a negative.
Yeah.
Sometimes when there's an experience like that, I've come to understand that pain is also like part of the healing process.
It's a teacher.
It's a teacher, that there could have been a blockage there, and that was an influencer of part of the overall experience that I might have actually needed that. So it's like I've learned that many times in my life, to say that like things that I've worked on internally and externally sometimes are extremely painful.
Yeah.
For the things that you have to deal with. I've confronted things within myself that were excruciating and didn't take 3 days. It took months and years to work out, internally within myself. So I just want to make that, because I don't want to say like, people that are listening like, oh, this one thing, I'm never going to do it again kind of thing. It's just that experience to me was like, whoa, it's very powerful, and
I'm glad you could see it from that lens too, because I was going to kind of touch on like what could have happened to you. It could have been two things. That one, they struck a nerve, right? And could have caused a little bit of damage with their needle technique. That could have happened. Or two, that point on the bottom of the foot is kidney 1. It's one of the most grounding points in the body. And then you said you couldn't walk for 3 days?
Yeah, well, I could walk, but my foot really hurt.
So in a way, it was kind of telling you maybe you need to slow down right now. You need to get grounded.
Yeah, absolutely. No, I was pretty crazy at that point in my life too.
Yeah.
So, I was living in like Portland, Oregon, and just being like a crazy person, trying to figure out my life. You
weren't grounded.
Yeah, I wasn't grounded. I feel like I'm a very grounded person, or at least a lot of people tell me that. But maybe at that moment, I wasn't more, where I should have been at that time. So that was my story. not the best one, but I would hope that.
That was a powerful point they did. I'm surprised they chose that when you're like new to their
just
clinic.
Going for it. Yeah,
like, why would you pick that?
I don't know. She's probably just going all out for it or whatever.
Gosh.
But yes, it was very like, and it sucked too, because at that time, like being very young, I think I was like 20 years old or something like that when this happened. Like my cousin was like, "Oh, so did you have a good experience?" And I was like, "Be honest with you, no, it was actually really terrible." Like, because she called me like the next day, and I'm like, "I can barely walk like right now." She's like, she couldn't really explain it well enough in the conversation that we just had. She was more just like, "Oh, I'm sorry," like kind of thing, and I was like. At that time, I was like, no, screw this thing. I'm never going to go back to this ever again.
I don't blame you. That would scare a lot of people away.
Yeah.
Yeah. But, now you've thought about it.
Yeah. I mean, it definitely took me a while, and I've had many experiences like that, with different treatments and working with different people where I've had way worse experiences that. So, but now I understand the healing value of something like that, and it's not going to make me shy away from doing something like that again. So I see the value in it, and I hope that other people too, even when you're dealing with something like that, it may be good for you in that moment. You don't like, as a human being, sometimes we have like a reaction, or, instantaneous reaction where we're like, oh, this is bad because it involves pain. And we want to run away from pain, so it's the animal instinct within us just say like, let's run away from this. But in all reality, there's so much value to
absolutely
that,
no pain, no gain.
Yeah, no pain, no gain. Exactly.
Not that it should hurt, but it's one of the biggest teachers is to experience pain in life. And unfortunately in our society, like everyone wants a quick fix, a
Mm.
pill for this, a pill for
Mm-hmm.
that. They don't want to feel the pain. That's
Yeah.
a problem.
Yep.
We
Yeah, it
have
really
to
is.
feel it. The only way through is through. Like, I'm sure you've heard that saying, and yeah, you have to feel it to heal it.
Mm-hmm.
You do.
Yeah, I mean, at this point in my life, I actually search for more of those things, the uncomfortability,
Yeah.
because I see so much of wisdom and the great teachings in finding that all the time, because through the suffering there's just so much beauty and where it comes from, because the rose needs to grow from the shit. It's a necessary thing.
It's
Yeah,
true.
and so these days, like, I've come so far to say that, like, I almost like it a little bit every day, because it gives me the ability to have the coexistence between the two, and to see the light and the dark of all things. So
Yes.
it's important, and I try and do that almost every morning. Try and find something where I'm like, I start my day off with being uncomfortable, so that anything else that comes at me during the day, I'm just like, it's not that big of a yeah, it's fun. Exactly. So
Nice.
do you, like, with the acupuncture and the Chinese medicine aspects of it, and understanding, that I got to see my partner go through some of it on the more medicine side of things, with like the herbs and everything. Is that also something you provide at
Yes.
your facility?
Yeah, so I'm a trained herbalist as well. I
Mm-hmm.
spent 5 years studying Chinese herbs, so I know a lot of stuff about herbs. And
Yeah.
they're not all Chinese, too. Some of them you would know, like ashwagandha or cordyceps or ginger.
Mm-hmm.
Like all of those things are part of the materia medica that we study. So I'm very well versed in prescribing herbs. That's a big part of Chinese medicine. Because what herbs do is the acupuncture can take you so far, but the herbs can extend your treatment like far beyond the treatment room.
Mm.
So you could get like one acupuncture treatment and then be on herbs for like a couple months and like get a really big benefit from just that.
Mm-hmm.
Yeah, so it's plant medicine. It's the power of the plants. It's all nature.
And so, what is like the divide? Do you usually give more acupuncture, or like more Chinese medicine too, or is it like a
It's
balance?
both.
It's about
Yeah,
both.
it's all of it.
Mm-hmm.
Yeah. I mean, the acupuncture is just like that physical modality, and that's part of Chinese medicine is acupuncture. So it's all of it. And we study Western medicine too. Like we're very well versed. We're just like MDs. We're just not called them.
Yeah.
Yeah, that's why we're a DACM, MD.
Yeah.
But our education is very similar, and it takes just as long.
Mm-hmm.
So there's a lot of knowledge.
That's a rigorous process.
Mm-hmm.
For sure. And there's, God, like, just looking at some of the language and the overall combinations, and having to understand it in Chinese, right?
Yeah, which
and then
is
in
a whole
English.
other thing.
Yeah, that's a whole other realm of understanding. But what I see through, like, this conversation, there's like so many avenues to explore, and everything that we're talking about. And really, what it comes down to is, I'd love to have another conversation with you about, like, that side of things,
Sure.
so that we could dive into the integration between both of
yes.
them. Because there's, like, I feel like there's the physical, the meridians, like the all the different parts of ourself that are all these, like, living things internally that we have to kind of treat. And then there's also, like, the energetic side, the higher side of everything,
Yes.
which is part of the meridians and the flow of everything. But I think it's also, like, the beautiful thing about what you do is you have such an integration of all these different things, aspects that you have to combine. And, like, when you're able to heal all the different planes, if you will, as a human being, and put somebody back together, they're able to heal fully, from whatever ailment that they're dealing with.
Yeah.
And I think that's an amazing thing.
So. Yeah, and my biggest goal is to just get someone to the point where they get into balance, and then they find when they get off balance a little bit, when they're off kilter, and they're like, wait a minute, now I can recognize when that's happening in my body, instead of waiting 5 years and then I have this disease.
Yeah.
And recognizing it right away.
Yes.
Is to just have that self-awareness. That's my goal.
I would like to talk about that because I think that's a huge one for a lot of people, is like if you're able to pick up on those little things over a course of time, it builds, and it turns into something, else, just like what we're talking about from the childhood experience. I think a lot of times that one unique experience, as it builds on itself, eventually turns itself into something, manifests into something way worse than it should have been from if it was healed, from the get go. So it's already been an hour.
Oh wow!
Isn't that
Time
amazing?
flies.
Time flies.
Good conversation.
Yeah, and so we obviously have a lot to talk about, and I would love to have you back here, or even like have dinner with you and your husband or something like that, because I love learning these things, and I would love to also try again with another session.
I would love that.
and it's just to keep it simple, and thank you so much again for being here and this conversation and driving up here, of course, too. And I welcome you back anytime, and we'll find another time to dive into everything else that we were just talking about.
Thank you.
Yeah.